Hi, I'm Dr. Nemechek, inventor of the Nemechek protocol for autonomic recovery and the reversal of autism and developmental issues in children. I want to talk to you today about a little confusing topic, a choice of words that people use, and it's really to try to help you delineate between what is dizzy, what is vertigo, what is lightheadedness, and what is disequilibrium. All right? So, first off, dizzy is a very, I know what people use it as, but medically it doesn't really mean so much. It's not a really precise word. So doctors, we like to think of people as having, when they're altered sensation, like the floor's moving or their balance is off or something's wrong in that kind of just general area, we like to look at a combination of two major things. One is vertigo, and that's where things are spinning, like you're on a carousel, or two, lightheadedness, and that is when you generally stand upright or sit, or you're sitting or standing still, and you feel like the lights are going to go out and you're going to pass out. Okay? Think of these as opposite ends. Now, sometimes it's not quite so clear, and people will use a term called dizzy. All right? They aren't quite certain, but it's just a general term the population uses to mean something's off. We actually often use for that a term called disequilibrium, which means your equilibrium or your balance system doesn't work right. Now, you can have vertigo, okay, where at its worst you're spinning, but maybe it's not quite that bad and you just kind of like feel like you're on a boat, okay? So vertigo can cause disequilibrium, all right? And lightheadedness, different thing. Stand up, you don't get enough blood pressure and oxygen to your brain, you think you're going to pass out, but maybe it's not quite so intense. It can make you kind of feel like your balance is off a little bit, and like you're on a boat, or you walk down the hallway, kind of just brush against the door jamb or something, you know. And so we'll say, that's also disequilibrium. So this middle ground can be both from two very different causes. Now, vertigo is a issue due to the balance mechanism not working right. Now, it doesn't necessarily have to be damage to the balance mechanism. It could just not work right. Say, for instance, if you have some sinus congestion. All right? And now the way you can tell a difference is this funny swimming sensation. So if here you are upright and you have those sensations, you'll still get those sensations if you're laying in bed. Or if you roll over in bed, you might, whoa, feel a little swimming, funny sensation. It's not really dependent upon you being upright, okay, like lightheadedness is. And so that's one clear way. You can tell, you'll still feel just as bad when you're laying down. Now, people with lightheadedness, their issue is they have trouble, typically from autonomic damage, but it could be like maybe you've got severe anemia, or you're truly dehydrated or something like that. You're having trouble driving blood pressure up to the top of your head, okay? So without getting enough oxygen up there, the brain doesn't work right. And at a mild degree, you're kind of off a bit. Your little balance is off, or you're just uneasy with your walking and things like that. Up to when you say get out of bed or get out of a chair like that, if you can't maintain the pressure in your head, your pressure drops, boom, you have a lack of oxygen. It's really lightheaded. Oh my gosh, I almost thought I was going to pass out. So again, lightheadedness is more like an intensity that if it keeps getting worse, you're going to pass out. Vertigo is more of an intensity that if it gets worse, you're spinning on a carousel, and both can cause this vagueness in between. All right? So now people can have both. It's not unheard of, but often with autonomic damage, the problem people have, their dizziness, is due to lightheadedness when you stand up. All right? Hope you find this helpful. This is Dr. Patrick Nemechek, Nemechek Autonomic Medicine in Buckeye, Arizona. Have a great day.